Carrying loads. Ramabai, a 45-year-old woman, approached her village doctor complaining of pain in her right shoulder with a very painful tender spot. The doctor examined her and came to a diagnosis of frozen shoulder. His accurate diagnosis could have been work-related, impingement syndrome of the shoulder with bursitis and possible tendinitis. Had he taken her work history, asking just a simple question, "What exactly is the nature of your work?" Effective history taking has long been identified as a core discipline in treating patients. Spending more time compiling a good patient history has been known to provide the most benefit as compared to long physical examinations and expensive laboratory tests. Collecting an incomplete history can affect initial therapy and all subsequent decisions for treatment. Therefore, it is essential that primary care physicians ensure that neither the patient nor the health system is unduly burdened by deficient history taking. Primary care providers and family physicians can play an important role in improving the recognition of occupational disease, preventing progressive illness and disability in their own patients, and contributing to the protection of other workers similarly exposed. This role can be maximized if physicians raise their level of suspicion for workplace disease, develop skills in taking occupational histories, and also learn basics of advising prevention. Industry profile. The growth of the informal sector in India has been alarmingly phenomenal, and the Ministry of Labour, Government of India, has characterized the unorganized labour force under 4 groups in terms of occupation, nature of employment, specially distressed, and service categories. Among these, the specially distressed category includes toddy tappers, scavengers, carriers of head loads, drivers of animal-driven vehicles, and loaders and unloaders. While there is very little by way of statistical analysis or epidemiological studies, it is widely recognized that the major feature of the specially distressed category is lower real wages. This, coupled with poor working and living conditions, makes it especially difficult for persons in this sector to take care of themselves and their health problems. Further, the sector is characterized by 1. Preponderance of casual and non-contractual employment. 2. Near absence of social security measures or work relations. 3. Lack of knowledge of worker rights. 4. Denial of minimum wages and unqualified work status with respect to education, skill, and training. Distribution of workforce. While there is very little official data on the percentage of informal or unorganized workers who perform the task of carrying of head loads, loading and unloading, there certainly are some sections that have some organization and worker protection. Carriers of head loads, loaders and unloaders in India may fall broadly into the following 4 categories. 1. Organized laborers who are a recognized part of production or service industries. The most prominent example is that of licensed porters at railway stations and docks. Other examples are loaders and unloaders who are engaged on an exclusive employment basis by movers and packers organizations. 2. Production units may not exclusively employ loaders and unloaders, but may expect workers to conduct these activities as part of their daily tasks. 3. Contract laborers who are not on the payrolls of the organization but are employed on a regular basis by firms for distribution or delivery. Examples of such firms are carrying and forwarding agencies, furniture shops, transport agencies, and so on. In most cases, these workers report to the proprietor or manager daily and inquire about new assignments. 4. Migrant laborers who move from one construction project or factory manufacturing construction materials to another. Sometimes manufacturers of finished goods have a seasonal requirement for unskilled workers such as loaders and unloaders, and these migrant workers come in handy. Some migrants also move from one annual fair to another and visit devotional places on festive days to obtain work. 5. Women workers are unusually low in this trade. However, they may find work in sand mining units or road construction projects where they may be required to carry headloads of sand or gravel. Some examples of women railway porters are to be found in Rajasthan. Characteristics of work. Whatever be the activity, the following are the characteristics of the carrying head loads and loading and unloading work. 1. Absence of either a formal employment agreement or a stable income in many cases. 2. Poor working conditions and an overwhelming absence of training regarding healthy and ergonomic practices. 3. Injuries and mishaps due to lack of protective gear or preventive measures taken while carrying, loading or unloading heavy goods or equipment. 4. Poor nourishment and hygiene leading to susceptibility to infections. 5. A variety of musculoskeletal disorders and discomfort are seen due to untrained lifting and material handling techniques. 6. Physical injuries due to lack of estimation of the worker's capacity for lifting loads. 7. Long working hours and poor socio-economic conditions may lead to strain on the body and onset of degenerative conditions. Health problems and disease patterns. Most of the work involving carrying of head loads, loading and unloading falls in the category of untrained and improper manual material handling and is a major predisposing factor for low back pain and shoulder injuries. Setting safe limits for manual material handling can be done through the following approaches. 1. Epidemiological. Determining the incidence of injuries in a given set of persons and analyzing the risk factors for these injuries. 2. Biomechanical. Estimating the body force applied during carrying of loads or lifting and unloading tasks and comparing them with standard tissue tolerance readings derived from cadaver studies. 3. Physiological. Estimating the energy requirements for carrying of head loads, loading or unloading tasks and comparing them with the aerobic capacity of the workers. 4. Psychophysical. Simulating a manual lifting or loading task in a controlled environment in a subject that matches age, physical condition, gender, and ethnic group of the target population. Advice to workers carrying heavy loads. The following steps or precautions need to be taken while lifting in order to safeguard health and prevent injury. 1. Testing the load and getting help if needed. 2. Planning the lift and the path to take. 3. Keeping the load as close to the body as possible. 4. Pivoting and moving one's feet to acquire a broad base of support and thereby preventing twisting. 5. Using smooth and coordinated movements for lifting loads. 6. Keeping the back as straight as possible from head or cervical vertebrae to tail or coccyx. In most cases, laborers are never trained to lift loads in an ergonomic and healthy manner, as a result of which acute injuries and chronic strain on the body leads to the onset of degenerative conditions early in life. While pain is the most overriding complaint, many laborers choose to withstand the pain rather than bear the costs of medical treatment. Some persons may take to alcohol consumption, which is usually more dangerous and life-threatening as they procure the cheapest alcohol that is illegally distilled and in some instances may contain methanol, which causes blindness, metabolic disturbances that lead to coma and even death. Health condition and causative source. Pain. Low back pain and shoulder pain. Causative source. Improper lifting of heavy loads, unscientific postures and load balancing by the body, failure to keep the back straight, failure to correctly transfer weight to relevant portions of the body during lifting, loading and unloading of heavy articles. Increased frequency of loading and unloading where the joints and muscles are held in unhealthy positions for protracted periods of time in suboptimal working conditions. Impingement syndrome of the shoulder. Shoulder pain along with bursitis and tendinitis. Causative source. Physical stress due to repeated overuse or sudden overload on the shoulder. Shoulder dislocation. Causative source. Excessive force applied in any direction may cause a dislocation. Lumbosacral and sacroiliac disc disease. Low back pain, restriction of back motion, S1 radiculopathy. Causative source. Disproportionate and constant physical stress due to faulty lifting techniques. Ideal recommendations for health, safety and welfare of workers carrying loads. Employers are required to carry out risk assessments and take action to protect workers from the risks of manual handling. Prevention measures include 1. Designing and organizing tasks to avoid manual handling completely or at least restrict it. 2. Using automation and lifting equipment. 3. Organizing manual handling tasks in a safe way with loads split into smaller ones and proper rest periods provided. 4. Providing information and training to workers on tasks and the use of equipment and correct handling techniques. Preventive interventions require strategic contribution and efforts from government through occupational health and safety policy and legislation, cooperation from employers as well as workers, and advice from medical professionals. Occupational diseases manifest after long latency period from the time of exposure. There are challenges to establish and declare that a disease is due to hazard at workplace. Elaborate guidelines for management and prevention of occupationally caused diseases is beyond the scope of this documentary, as currently there is no mechanism for doctors to enforce their recommendation without a statutory backing. We therefore give general principles of prevention. Preventive measures should be designed and implemented at 3 levels of prevention. 1. Primary prevention aims to reduce the occurrence of disease by eliminating the cause of disease, for example, use of benzene-free solvents or solvent-free paints to eliminate the risk of carcinogenicity, or reducing exposure to safe levels that prevent it from causing damage, for example, reducing noise at its source to levels that do not cause noise-induced deafness. 2. Secondary prevention to identify and treat health problems as early as possible, often before symptoms have developed, in order to take corrective action. For example, regular audiograms among workers exposed to high levels of noise in the work environment. 3. Tertiary prevention aims to avoid complications of and disability from illnesses and injuries and/or to provide rehabilitative and palliative care. It aims to minimize the consequences in persons who already have disease and depends on appropriate treatment. We expect that the primary care physicians are already well versed with clinical knowledge for management of the occupationally caused health conditions. To learn more about detailed clinical perspective, treatment and prevention and control, please refer to ebook or printed version of BOHS for informal industry, manual for primary care providers. So, if your next patient with any of the presenting symptoms we described earlier comes for treatment, please don't forget to ask him the $1 million question. What exactly is the nature of your work?